Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. What should everyone include in an urgent care kit? I'll go over that with my guest, Dr. Kaitlyn Lavarnway. She's an emergency physician completing a fellowship in emergency medical services at Upstate. Welcome to the Informed Patient, Dr. Lavarnway.
Hi, thanks for having me.
Many of us have heard of first aid kits, but an urgent care kit seems to be more. Can you explain the difference?
Yeah, so a first aid kit is your basic supplies for just cuts and scrapes, very simple things. An urgent care kit expands on that a little bit and involves some additional wound care supplies, some basic medications, a few basic important tools, and then my top recommendation is also including some information in there as well.
All right. Now, when did urgent care kits come into existence?
It's not really a formal medical term. It's basically just this consumer-friendly preparedness concept and kind of growing more as people are getting more and more interested in being at home and being prepared. Obviously, we all just went through a pandemic, so I think that it sparked a lot of interest in this. But the goal is just to help with some basic minor illnesses, minor injuries, and things that are helpful for when you can't easily get to a pharmacy.
Is it meant to be a segue to the emergency department or instead of going to the emergency department?
So, not necessarily instead of the emergency department. I think it's just for handling basic things at home. And I think you're touching on something I really want to hit home is that the biggest thing is knowing when something is beyond what you can handle at home and when it's time to seek a higher level of care.
That can be tricky too. So I know we'll talk more about that. But before we move on, the urgent care kit, is it meant to be something that you have at home or is it meant to be mobile in the car?
So I think it can be both, and I actually do recommend both. I think it's helpful to have a little bit more of a robust kit in your home and then something a little smaller and more portable and more travel and emergency focused to keep in the car. Your home kit is going to be a little bit more comprehensive. And then the things that you're going to keep in the car are going to be a little bit more tailored to things that are going to be involved with traveling or emergencies on the road. I do want to include a really quick caveat on that is that the things that are included in your car, you just have to be careful that they're not really sensitive to heat or cold or whether sunlight will affect them.
Good point. Now, we've seen these prepackaged urgent care kits for sale on television and ads and things. Do you recommend people buy the prepackaged ones or do their own?
Either is perfectly fine. I think the biggest thing is not whether you bought it yourself or put it together. The biggest thing is having it to begin with, knowing what's in it, knowing where it is, and how to actually use the things that are in it. So, the benefit of the pre made kits, it's convenient, it's easy, it's definitely better than nothing. And then the advantage of building your own allows you to customize it. So whether you have kids at home versus an all adult household or elderly in the household or any specific medical needs in the household might allow you to tailor that kit a little bit more towards your family.
Well, let me ask you if you can go through a list of things that would be good to have in an urgent care kit. What are your most important items that you would think everyone would need?
I'm going to break them down into categories so it's a little bit easier to digest. For wound care, I think you probably should definitely have a decent section of wound care things. Things like bandages, maybe some sterile gauze. Medical tape is really important. Ace bandages or some sort of elastic bandage to keep bandages in place that are on awkward areas of the body. Antiseptic wipes, antibiotic ointment, and ideally a pair or two of disposable gloves. And then my next category is tools. So things that can be really helpful are tweezers, a small pair of scissors, some sort of thermometer, ideally just a simple digital thermometer, maybe a small flashlight, and some instant cold packs. And then that brings me into medications. So you do want to have some kind of common over-the-counter medications available, things like acetaminophen, also known as Tylenol, ibuprofen, also known as Motrin, maybe some sort of allergy medication, either Benadryl, which is diphenhydramine, or cetirizine, which is Zyrtec, or any of the other over-the-counter allergy medications. Something that can also be helpful is oral rehydration packets just for electrolytes if you're dealing with a situation where somebody is getting towards being dehydrated. Other things that can be helpful are cough drops, saline eye wash, and even some saline nasal spray. And then my last thing, I think, is the thing that people often really forget is including information as well. So your emergency contacts, medication lists, allergies, major medical conditions, and advanced directives if that applies to you. Whether it's physically in your kit, like maybe in your car kit, you have a card or a wallet card, or just knowing where it is in your home, ideally somewhere that's easy to get to and visible, like on the side of the fridge. I think just having all of that information to have in the case that there is some sort of emergency is really helpful.
And you need that information for each member of the family too, right?
Yes, yes. Definitely important to keep it and then just keep it updated as things change.
Now, what about prescription medications? Would you ever include those?
So I don't necessarily think it's a great idea to include extra prescription medications because there's always a cost involved or it's hard to get extra to have on hand. So I think what's more important is just having a plan for those medications. So if something were to happen, how would you easily get to them or what would you do if you needed to go somewhere quickly?
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Upstate emergency physician Dr. Kaitlyn Lavarnway. Now, how often do the items in the kit need to be swapped out or updated? I know you mentioned a lot of tools, and those are probably good forever, but some of the medications in there, even acetaminophen, Tylenol, cough drops, do those go bad? Do they need to be rotated?
I would definitely check your kits once or twice a year, even if you just put it on your calendar once a year to just check your kit. Look for anything that's expired or anything that's missing. Say you use something and you've got to replace it, or things that are obviously soiled or dirty or broken open. Those are things that you want to replace. Any medication tends to have a little bit of leeway, but it is a good idea to follow the expiration dates on those bottles to make sure that they're working appropriately when you need them.
And are any of those, the medications and even the saline eye wash, are those sensitive to cold and heat?
Yes, things like the saline eye wash are usually sensitive to cold and heat. Any liquids are, or even antibiotic ointment sometimes can be sensitive to cold and heat. So that's just something usually you want to look on the packaging, and it should hopefully help you decide whether it's something that shouldn't be stored in a car and should probably just be kept at home.
All right, so now for the probably most important point is how to tell whether you can take care of the illness or injury on your own at home with your urgent care kit or if you need to be moving to the hospital or emergency department. Do you have advice to help people make that decision?
Yeah, the first thing that I would say is listen to your gut. If something is telling you that it's beyond you, go seek a professional. But things that are hard and fast, like definitely go to the ER or seek a higher level of care, would be things like chest pain, anything with issues with breathing, stroke symptoms. And granted, that's a separate lecture, but knowing how to recognize common stroke symptoms is really helpful. Any severe allergic reactions or anaphylaxis, any significant bleeding, major trauma, any loss of consciousness, or anytime somebody passes out, severe abdominal pain, any confusion, or anything that really just happens really fast, or it's getting worse, or it's just really severe. Those are all things that you definitely want to seek a higher level of care. And then there's a couple of things that I think aren't necessarily common knowledge that are good things to know about certain wounds that really should get a higher level of care. So certain wounds, there are some hard and fast rules that you definitely want to get them looked at by a professional. Those would be things like animal bites, deep puncture wounds, anything really contaminated and soiled and dirty, any injuries or cuts involving the face or the hands, and then also anything directly over a joint. Those are definitely things that you want to get looked at.
An emergency can happen anywhere. You may be far away from a hospital if you're camping, say. So, is this something that you could maybe help take some of these items from the urgent care kit to make use of while you're going to the hospital or while you're waiting for the ambulance for that matter?
Yes, definitely. I would say with certain medical problems, I would probably hold off on things like the pain relievers like Tylenol or Motrin until you know what's going on and they can do that appropriately at the hospital. But for things like wound care, I think that is really helpful to buy yourself some time to get to somewhere else. Granted, this wilderness medicine is its whole niche of preparedness level of stuff. But if you were out in the wilderness, just having basic wound care supplies so you can at least keep something clean and covered is really important. Or having triangular bandages, which are basically just strips of triangular cloth, using that to either tie your shoulder to splint it to your body or tying sticks together to splint it. That can definitely buy you some time to get to the ER.
Any advice for a layperson about how to stay calm in the face of an emergency?
I think the biggest thing is being prepared, and knowledge is huge for that. So having basic knowledge of what to do in an emergency supersedes even anything that you could possibly have in a kit. Things that I really recommend people have would be basic CPR training that can truly save a life. And just knowing how to do that is so important. Other commonly offered things to the public are things like stop the bleed training, which is some basic training for dealing with any major bleeding to buy you some time to get to the hospital. And I always tell people just take a deep breath, take one step at a time, and call 911 early. And the dispatcher is going to walk you through a lot of what you need to know.
That sounds like good advice in terms of if you go through training and you know what to do to stop bleeding, maybe you'll be able to do it more level-headedly when it's your child who's bleeding because you've done it before.
Yeah, and that's the goal. Nothing can truly prepare you for that moment. And I think even myself as a physician, if it was my family, it's probably going to feel a little bit different. It's going to feel much more scary. So nothing can truly prepare you for that. But I think the more knowledge that you have, knowing to take a deep breath, take a second, take things one step at a time, try to identify the absolute number one most pressing issue that you have to deal with right now and calling for help. I think that can really go a long way.
So, what would you like listeners to come away with after this interview?
Some of the key takeaways, if you listen to nothing else that I've said, I think the things that I would really want to stress would be being prepared is more than just supplies. The best kit is the one that you actually know how to use. And sometimes being prepared isn't just something you buy, it's having the knowledge of how to use it. And the one other thing I want to say is make sure you keep information like medication lists in your kits. And quick plug for get out there, get your CPR training, know where your EEDs are. And if your local firehouse offers a stop the bleed course, consider taking it.
Well, Dr. Lavarnway, thank you so much for taking time to tell us about urgent care kits.
Of course, thank you for having me.
My guest has been Dr. Kaitlyn Lavarnway, who is completing a fellowship in emergency medical services at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.